Welcome to this overview of Medicaid waiver and referral programs for the Comprehensive Class Member Transition Program provided by the UIC College of Nursing. This training will explain the various Medicaid waivers available in Illinois and their eligibility requirements and services, describe the Determination of Need process, or DON, and introduce the referral service programs available in Illinois. Medicaid waivers are programs run by the state to provide an alternative to institutionalization by providing home or community-based services. These services are funded in part by the federal government and must meet certain guidelines set out by the Centers for Medicare and Medicaid Services. In Illinois, there are 9 waivers, but not all of them are relevant to Colbert-Williams class members. Class members can only receive services under one waiver at a time. The Illinois Department on Aging administers one waiver, the Community Care Program for older adults. The Department of Human Services administers the Home Service Program waivers, including those for physical disabilities, people with brain injuries, and people living with HIV or AIDS. Finally, the Department of Health Care and Family Services oversees the Supportive Living Program waiver. There are additional waivers that apply to individuals with developmental disabilities and children. Illinois uses the Determination of Need assessment, or DON, to determine whether an individual is eligible for waiver services. The DON includes the MMSE, the Mini Mental Status Evaluation, to assess cognitive function, as well as an overall assessment of the class member's functional abilities and limitations. The Functional Status Evaluation looks at the individual's level of impairment, as well as their level of unmet needs. When necessary due to the severity or type of impairment the individual is experiencing, an informant or collateral source may be used. For Illinois waivers, DON scores must reflect the member being at risk of nursing facility placement. This requires a score of 29 or higher, with at least 15 points in the Need for Care category. The functional status portion of the DON looks at the member's level of impairment and unmet needs in 15 categories. Each is scored from 0 to 3, where 0 indicates no impairment or no unmet needs, and 3 indicates maximum impairment or entirely unmet needs. We will now look at the relevant Illinois waiver programs in more detail. The Illinois Department on Aging oversees the Community Care Program. This waiver serves adults aged 60 and older. They must meet the general DON requirements, maintain engagement in the Medicaid application process, and have total assets of $17,500 or less. The Aging Waiver offers adult day services which are provided at an adult day center and include health, personal care, and recreational or therapeutic activities. The Automated Medication Dispenser Service is a device that is programmed to dispense oral medications or alert the member to take liquid or injectable medications in their residence. It can also track missed doses and provide notifications to caregivers. The Emergency Response System is a device that provides 24-hour coverage to activate emergency services when activated. In-home services are provided by homemakers who can help with household tasks and personal care activities. The Home Services Program for persons with physical disabilities is administered by the Illinois Department of Human Services, Division of Rehabilitation Services, or DRS. Recipients under this waiver must be under the age of 60 at the time of application, although services can continue beyond age 60 if they are already established. As with all waivers, individuals must have a DON of at least 29, with a minimum functional impairment score of 15. Recipients must be diagnosed with a severe disability. The service cost must be less than a nursing facility placement. The recipient must cooperate with Medicaid processes, and there is an asset limit of $17,500 for adults. Personal assistant services are provided by individuals who are selected employed, and supervised by the member. These individuals can assist with household tasks, personal care, and with the medical provider's permission, certain healthcare procedures. Homemaker services are provided by trained and supervised staff employed by homemaker agencies. Adult daycare is direct care and supervision in a community-based setting for promoting social, physical, and emotional well-being. Environmental and accessibility modifications can modify a home to accommodate an individual's loss of function. Assistive equipment are devices or equipment that increase an individual's independence and ability to perform household or personal care tasks safely. Home-delivered meals are provided to members who can feed themselves but are unable to prepare a meal. One or more ready-to-eat meals per day are delivered to the home. The Personal Emergency Response System, or PERS, is a device that provides 24-hour coverage to activate emergency services when activated. Respite care is temporary care for members aimed at relieving family stress, for vacation, rest, errands, or a family crisis or emergency. Individual and agency-based home health services, or extended state plan services, are services available through the state plan, except the limitations on amount, duration, and scope in the plan do not apply. Home health care includes skilled nursing and home health aides. Finally, therapies include speech, hearing, and language therapy, physical therapy, and occupational therapy. The next DOORS waiver is the Home Services Program for persons with brain injury. This is open to individuals of any age with a diagnosis of acquired brain injury. The DON requirements, service cost maximum, and asset limits are identical to those for the physical disabilities waiver. The diagnoses covered under this waiver include traumatic brain injury, infections like encephalitis and meningitis, anoxia, stroke, aneurysm, electrical injury, neoplasm, and toxic encephalopathy. Individuals with a congenital brain injury, like cerebral palsy, seizure disorder, or learning disability, or brain injury due to neurological deterioration due to aging, such as Parkinson's or Alzheimer's disease, are not eligible unless they have an additional brain injury listed here. Services available under the brain injury waiver include the same as the physical disabilities waiver. In addition, this waiver covers additional services. Dehabilitation assists an individual in the acquisition, retention, or improvement of self-help, socialization, and adaptive skills. These services are provided outside the member's residence. Pre-vocational services prepare a member for paid or unpaid employment, but are not job task-oriented. These include teaching compliance, attendance, task completion, problem solving, and safety. Behavioral and cognitive rehabilitation are remedial therapies that assist in overcoming severe behaviors and may also include family counseling. Supported employment consists of paid employment for persons for whom competitive employment is unlikely. In order to receive SEP, customers must have received supported employment through the Vocational Rehabilitation Program and have entered extended services. The Home Services Program for persons with HIV/AIDS is the third DOORS waiver. This waiver has the same basic eligibility requirements related to DON score, service cost, Medicaid applications, and asset limits. It is open to members of any age who have been diagnosed with HIV or AIDS with severe functional limitations, which are expected to last for at least 12 months or the remainder of the individual's life. Services available under the HIV/AIDS waiver include the same as the physical disabilities waiver. In addition, this waiver covers transportation for employment. Commuting transportation services provided by local public transportation or an approved DOORS provider to allow a member to commute from their home to their place of employment, provided the member works a minimum of 20 hours per week. The Supportive Living Program waiver is administered by the Illinois Department of Health Care and Family Services. Residents must be elderly, 65 or older, or have a physical disability and be between ages 22 and 64. Different facilities serve the elderly individuals with dementia, and younger people with physical disabilities. SLP residents must have a Dawn score of 29 or more, reflecting a risk of nursing home placement. If applicants are suspected of having a developmental disability or serious mental illness, they must complete the pre-admission screening and resident review process to determine if the developmental disability or serious mental illness would exceed the service capability of the supportive living provider. In addition, residents must have their name checked against sex offender registries, have a negative tuberculosis test, and must have income no less than the current maximum SSI amount for an individual. Current income limits are available on the HFS website. Residents cannot receive services from any other home and community-based services waiver. Services available in supportive living programs include personal care or assistance with activities of daily living, medication management, including ordering, setup, reminders, and administration, intermittent nursing care, including assessments, meals and snacks, social and health promotion activities, maintenance, emergency call systems, well-being checks, and housekeeping and laundry. Additionally, some providers are certified as dementia care settings and provide specialized services to people with Alzheimer's and related dementias, and also those with symptoms related to internal pathological changes in the brain. In addition to the listed services, dementia care settings provide alarmed, delayed exit doors when needed, well-being checks up to 3 times a day, additional social or health promotion activities, and have additional requirements for staffing and staff training. The referral programs are offered by several Illinois Department of Human Services divisions. These programs do not provide services directly, but instead help to link class members with service providers in the community. The Division of Mental Health offers a continuum of services from intensive inpatient hospitalization to outpatient care alongside supportive housing and employment programs. Services are provided by qualified mental health practitioners in mental health centers and hospitals. These providers include medical providers, psychiatric providers, psychologists, social workers, counselors, and nurses. They are assisted by trained and experienced paraprofessionals and recovery support specialists. Services are available depending on the person's needs. The process of care generally begins with an assessment, followed by recommendations, treatment, and support. In a crisis, after an assessment, a person can begin intensive treatment in a hospital or with community crisis services, and then transition to less intensive services. Services available include community support, psychosocial rehabilitation, case management, therapy and counseling, crisis intervention, or assertive community treatment, or ACT. The Division of Alcohol and Substance Abuse is the state's leading agency for addressing the personal, social, and economic consequences of substance use disorders. DASA administers a network of community-based substance-related disorder intervention, treatment, and recovery support services throughout the state to individuals and their families. Services are also available for gambling disorders. DASA licenses substance use disorder programs and provides funding to a subset of these programs to support intervention and treatment to individuals who cannot afford services. The network of licensed providers enables individuals to be assessed and treated as close to their home communities as possible. Services available include withdrawal management, such as medication-assisted treatment, early intervention, case management, outpatient and residential treatment, and recovery support. DASA also licenses evaluation and risk education programs for individuals arrested for driving under the influence, and recovery homes that are sober living environments for individuals in recovery. The Division of Developmental Disabilities provides quality outcome-based services and supports for people with developmental disabilities and their families. DDD is committed to implementing a system of services and supports in full partnership with the people it serves. The member, their primary caregiver, or legal representative must first meet with an Independent Service Coordination Agency, or ISC. These agencies, also known as Pre-Admission Screening, Independent Service Coordination, PASS, ISC agencies, are the front doors to state-funded services. The pre-admission screener will see if the member is potentially eligible for services and fill out a prioritization of urgency of need for services, PUNS enrollment, with information about current and future needs for services. PUNS is the state's central registry of persons with developmental disabilities who are waiting for services. It is used by DDD to authorize individuals for services and supports as funding becomes available. Services available through DDD include residential living arrangements, in-home supports, day services, and other supports such as adaptive equipment, speech and language therapy, occupational therapy, physical and behavioral therapy, and respite care based on the availability of funding. Current versions of all comprehensive program policies and forms, as well as educational resources, can be found on the Colbert-Williams training website managed by the UIC College of Nursing. Any questions can be directed to the Colbert-Williams help desk listed on that site. Thank you for your attention and efforts to ensure safe and successful member transitions.